Hello, and welcome to this short video on how to identify and refer eligible patients into the Queensland Government's My Health for Life program using Cat4, brought to you by the Digital Health team. In Queensland, we have a high number of people with untreated high cholesterol and high blood pressure. We also have up to 60 cases of type 2 diabetes diagnosed daily, and heart disease is a leading cause of death. That's why we need you to help us reduce the risk of type 2 diabetes, heart disease and stroke by referring patients to a 6-month lifestyle program designed to help them action their health goals. GP-referred participants are more likely to see the program through. Participants can choose from flexible delivery via the phone, a group or online. The program's delivered by experienced health professionals, and there's no contracts or fees and plenty of support. Patients with the following existing conditions are automatically eligible: gestational diabetes, pre-diabetes, high blood pressure and high cholesterol. Patients are also eligible if they have an OS risk score of over 12, an absolute cardiovascular risk score of above 15, a BP reading of either over 160 systolic or 100 diastolic. However, patients that are currently diagnosed with type 1 or type 2 diabetes, heart disease, or chronic kidney disease are not currently eligible for the program. As part of our data program, you'll be familiar with Cat4. To find your recipes, go to help.pencs.com.au, click on Cat Recipes. Halfway down on the left-hand side, you'll find the My Health for Life recipes. There are 6 recipes for you to generate patient lists from. And you'll also find an eligibility criteria diagram at the base of the page. For today, we're going to go through the first recipe. Okay, so this is what you will see when you open up Cat4. You want to make sure you're on the little report function here. And then we're going to come and view extracts and highlight the latest data extract, and then we can just hide that. Click on view filter, and this is where we're going to start filtering patients based on certain criteria. So we want a starting age of 45 for the first recipe that I printed off. We want to hit active patients that have been to our practice at least 3 times in the past 2 years. And then we want to filter in some conditions. So we don't want people that are currently diagnosed with diabetes, anything to do with heart failure. We're looking for patients that are trending towards a chronic disease, and we're trying to put some prevention measures in place. So no also to anyone with chronic renal failure. And then we just want to make sure that the latest results for any pathology is within the last 24 months, and then we hit recalculate to generate that data. And now that we have that, we also want to make sure that we include people with certain conditions. So we're going to go conditions and other, and we're going to say yes to familial hypercholesterolemia. And we're going to come here to medications, and medications we want yes to lipid modifying ones. And then we want to make sure that we capture people with a high blood pressure. So we're going to come in here to measures and then BP, and then we want to select the highest one here. And the final thing we need is pathology, and it's already on lipids and cholesterol, and we're going to select the top 3, so 5.5, 6.5 and 7.5, and we're done. And now we can just pop up to our report button and click OK. And this will generate a list of patients that are based on all of the eligible criteria for the My Health for Life program. And we can recall them. If you have Medical Director or Best Practice, you can find a preloaded referral in the supplied template section. Complete the referral and send it via secure messaging or fax.